Hey, welcome back. Before we get into anything else, I want to tell you exactly what this video is and what it isn't. It isn't a miracle list. It isn't one weird trick your doctor doesn't want you to know. It's 5 habits backed by the actual research I could find and verify, not just repeated across 100 SEO blogs, that are worth knowing about if you're a man in your 60s, 70s, or 80s, or if you're watching this for your dad, your husband, your grandfather. I'm not a doctor, I'm a researcher and content creator. And everything in this video is something I pulled from primary sources, the actual studies, government health sites, or major medical institutions, and cross-checked before putting it in front of you. Where the evidence is strong, I'll tell you it's strong. Where it's mixed, preliminary, or based on one study, I'll tell you that too. That's the deal. So let's start with why this even matters, because I think a lot of men tune this topic out until something forces them to pay attention. Why the prostate becomes a bigger deal after 60. Here's the basic biology, and I want to keep this simple. The prostate is a small gland, sits just below the bladder, wraps around the urethra. The tube urine passes through. Doctors sometimes describe it like a donut with the urethra running through the hole, or like an orange with a straw through the middle. When you're young, that gland stays roughly walnut-sized. But as men age, it's extremely common for the prostate to keep growing. That growth, called benign prostatic hyperplasia, or BPH, isn't cancer. It's just tissue growth. But because the urethra runs right through the middle of it, an enlarging prostate can squeeze that tube and make urination harder, more frequent, or more urgent. According to Mayo Clinic, by age 50, roughly half of men will have some symptoms of BPH, and that number keeps climbing with age G. More than half of men in their 60s and up to the large majority of men in their 70s and 80s report at least some urinary symptoms tied to prostate enlargement. So if you're in that 60, 70, 80 range and you've noticed you're getting up more at night, or your stream isn't what it used to be, or you feel like you never fully empty, you are not broken, and you are absolutely not alone. This is just what tends to happen. Then there's the other conversation nobody loves having, prostate cancer. It's the most commonly diagnosed cancer in men in a lot of countries, and it disproportionately affects older men. The average age at diagnosis is in the late 60s, and most prostate cancer deaths occur in men over 75. That's not meant to scare you. It's meant to explain why the habits in this video matter more the older you get, not less. And here's something worth sitting with for a second, because it actually reframes the whole conversation. A large share of prostate cancer in older men is slow growing. That doesn't mean it's never serious. Some prostate cancer is aggressive and needs real treatment, no question. But it does mean this isn't a topic where panic helps you. The habits that follow aren't about scaring you into action. They're about the boring, unglamorous stuff. Movement, weight, fluids, honest conversations with your doctor that the research actually supports. Now here's the important nuance, and I want to say this clearly up front. Most of what I'm about to walk you through is about lowering risk and easing day-to-day symptoms. It is not about replacing medical care, screening, or treatment. If you're on medication for blood pressure, your heart, diabetes, or anything else, please loop your doctor in before making any of these changes, especially the diet and supplement pieces. Some of these habits can interact with medications in ways that matter. This is probably the most misunderstood part of prostate health, so let's slow down here. A lot of men assume that getting a PSA test, the blood test that checks prostate-specific antigen levels, every single year, no matter what, is just automatically the responsible thing to do. But the actual guidance from the U.S. Preventive Services Task Force, which is the government body that reviews this evidence, is more nuanced than that, and it changes specifically around the age range this video is about. For men aged 55 to 69, the the USPSTF recommends what's called shared decision-making, meaning you and your doctor talk through the pros and cons together and decide based on your personal risk and preferences. But for men 70 and older, the USPSTF actually recommends against routine PSA screening, not because your prostate stops mattering at 70, but because the math on risk versus benefit shifts. I verified this same recommendation independently on the official USPSTF site and on the U.S. government's Healthy People 2030 Health Resource page, and they say the same thing. Screening in men 70 and older is generally not recommended because, in their words, the potential harms are at least moderate and greater than in younger men. What are those harms? A few things. First, false positives. The PSA test isn't especially precise, and elevated PSA can be caused by things that aren't cancer at all, like an enlarged prostate or an infection. Multiple sources describe the false positive rate as approaching half of all positive results, and that issue gets worse with age. Second, even when cancer is found, a large share of prostate cancers in older men grow so slowly that they never would have caused a problem in that man's lifetime. That's called overdiagnosis. And third, once you find something, there's real pressure to treat it, and treatment itself carries risk. Research reviewed by the USPSTF found that a meaningful proportion of men who have surgery for prostate cancer go on to experience long-term urinary incontinence, and a majority experience some degree of long-term erectile dysfunction. Those aren't small side effects. So what does this mean practically? It does not mean ignore your prostate after 70. It means the decision to keep testing, stop testing, or test selectively should be a conversation with your doctor, tailored to your health, your family history, and your life expectancy, not a habit you keep doing on autopilot because that's what you did in your 50s. Men at higher baseline risk, for instance, men with a strong family history of prostate cancer, may still have good reason to continue individualized screening discussions well past 70. This is genuinely a talk to your doctor habit, not a do this thing habit, and I think that honesty matters more than a tidy answer. This one's less dramatic, but it might be the habit that changes your day-to-day life the most, especially if nighttime bathroom trips are already an issue. Mayo Clinic's guidance on enlarged prostate and diet is refreshingly specific here. They recommend cutting back on caffeine and alcohol because both can irritate the bladder and make you feel like you need to urinate more often. They also recommend avoiding drinking a lot of fluid in the few hours before bed or before you're heading out somewhere you won't have easy bathroom access. This isn't about dehydrating yourself. Staying properly hydrated during the day still matters for your kidneys, your heart, basically everything. It's about front-loading your fluids earlier in the day and tapering off in the evening so your bladder isn't fighting you at 2 a.m. If you're on blood pressure medication or a diuretic, this is exactly the kind of habit where I'd tell you to loop your doctor in, because fluid timing and certain medications interact, and you don't want to make a change that affects how your medication works without a quick conversation first. There's a broader piece here too. Mayo Clinic's bottom line summary on this is that regular exercise, watching your waistline, eating a wide variety of vegetables and fruit, and limiting saturated fat may all ease BPH symptoms. And as a bonus, those same habits lower your risk of erectile dysfunction, diabetes, and heart disease. So this isn't a narrow prostate diet. It's really just a solid general health pattern that happens to be especially relevant to your prostate. I think this habit gets dismissed because it sounds almost too simple to matter. But think about what's actually happening physiologically. Caffeine and alcohol are both mild diuretics and bladder irritants, meaning they can make your bladder feel fuller and more urgent than it actually is, on top of just producing more urine. If your prostate is already narrowing the urethra even slightly, That extra irritation and extra volume is exactly what tips you from "I can wait" to "I need to go right now." Shifting your coffee to the morning, having your evening drink earlier if you drink at all, and easing off both in the hours before bed is a genuinely low-effort change that a lot of men simply haven't tried because nobody ever framed it as a prostate habit specifically. Now, here's where I get genuinely excited about the research because this is one of the more consistently supported habits on this list. There's a well-known study out of the Harvard School of Public Health, published in the early 2000s and followed up on since, that tracked physical activity in tens of thousands of men over time. What they found, specifically in men 65 and older, was that high levels of vigorous activity, things like running, biking, swimming, brisk walking at a real pace, were associated with a notably lower risk of advanced and fatal prostate cancer. I want to be precise about what notably lower means here, because the actual numbers are striking. Men in the highest vigorous activity category had roughly a 2/3 lower relative risk of advanced prostate cancer and roughly a 3/4 lower relative risk of fatal prostate cancer compared to men who did essentially no vigorous activity. In an observational study, which means this shows a strong association, not proof that exercise directly causes the reduction. That same research group and other independent groups have also looked at physical activity after a prostate cancer diagnosis, not just before, and found something similar. Men who kept up several hours a week of vigorous activity after diagnosis had a meaningfully lower risk of dying specifically from prostate cancer compared to men who did less than an hour a week. Now, I checked this against a broader review of the exercise and prostate cancer literature, covering studies going back to the 1970s. And the honest picture is, the majority of studies point the same direction, near more activity, lower risk. But not every single study agrees, and the review itself says that conclusive proof of the relationship is still elusive, even after decades of research. So I want to be fair to the evidence here. This is a strong, consistent signal, not an ironclad guarantee. What is consistent across basically every study is that the benefit shows what's called a dose-response relationship, meaning more vigorous activity tends to track with more benefit, and it seems to matter more than just casual movement. Practically, this doesn't mean you need to become a competitive cyclist at 72. It means building in real, elevated heart rate activity a few times a week. Brisk walking counts, swimming counts, biking counts, at a level that's sustainable for you. And obviously, if you have a heart condition or you're on medication that affects your heart rate or blood pressure, this is a check with your doctor before ramping up intensity situation, not a push through it situation. This is the habit I think gets underestimated the most because people hear lose weight and assume it's generic advice that applies to everything. But for prostate health specifically, the research on this is unusually strong and consistent, which is part of why I want to spend real time on it. Harvard Health, summarizing research published in the journal Cancer, described a study that followed men diagnosed with prostate cancer and tracked their weight and waist size over about a decade. The findings: a 5-point increase in BMI was associated with a 50% higher risk of advanced or fatal prostate cancer, and roughly a 4-inch increase in waist size was associated with a 40% higher risk. The same research found that visceral fat, specifically the deep abdominal fat that surrounds your organs, as opposed to fat just under the skin, was linked to about a 31% higher risk of advanced prostate cancer. I want to flag that these are relative risk increases from one specific study population, not a guarantee about any individual man's odds, but the direction and consistency of the finding is notable. I cross-checked this against a completely separate line of research. The American Institute for Cancer Research's Continuous Update Project, which reviews the global body of evidence across many studies. Their expert panel concluded that obesity is now linked to more aggressive, deadlier forms of prostate cancer specifically, even though the relationship between weight and just getting prostate cancer at all in the first place is less clear-cut. Their estimate was that a meaningful share of advanced prostate cancer cases could potentially be prevented if men maintained a healthy weight. A broader scientific review I checked, looking across many pooled studies, similarly found roughly an 8 to 11% increased risk of advanced prostate cancer and prostate cancer-specific death in men with obesity, with risk increasing incrementally as BMI climbs. So two independent lines of evidence, a specific cohort study, and a broader research review land in the same place. Weight, and especially abdominal fat, is tied to worse prostate cancer outcomes, particularly the aggressive kind. There's one honest wrinkle worth mentioning. Not every study agrees on every detail. One Harvard-affiliated study specifically looking at men who already had localized early-stage prostate cancer found that weight change and BMI weren't clearly linked to cancer progression in the group as a whole, though there was a signal in never smokers that long-term weight gain was tied to worse outcomes. I'm telling you this not to muddy the water for the sake of it, but because rule number 1 of this video is, when sources disagree even a little, I tell you that instead of picking the scariest number and running with it. The practical takeaway: this isn't about chasing a number on a scale for its own sake. It's about your waist size and your overall metabolic health, the same stuff that matters for your heart and your diabetes risk. And again, any real change to diet, exercise intensity, or weight loss strategy should go through your doctor first if you're managing a chronic condition or taking medication, partly because rapid weight loss can sometimes affect medication dosing. I want to spend real time here because I think this is where a lot of well-meaning men get misled, often by supplement marketing that sounds a lot more confident than the actual science. Let's start with saw palmetto, because it's the most heavily marketed prostate supplement out there, and I want to be very direct with you about what the evidence actually shows. I checked this against the NIH's own National Center for Complementary and Integrative Health, a large NIH-funded clinical trial published in JAMA, and a 2023 Cochrane review, which is about as gold standard as evidence review gets, covering 27 randomized controlled trials and over 4,600 men. All three sources land in the same place. Saw palmetto, taken alone, does not outperform a placebo for BPH urinary symptoms, not at standard doses, and this part surprised me, not even at 3 times the standard dose, which is exactly what the NIH-funded trial specifically tested because they wanted to rule out the idea that people just weren't taking enough. The NIH's own summary phrase for this is that saw palmetto is probably not helpful for urinary symptoms tied to prostate enlargement. So if you're currently taking it, this isn't me telling you it's dangerous. The same sources suggest side effects are rare and mild, but I'd rather you know the honest state of the evidence than keep expecting a result the research says probably isn't coming. And to be fair to the other side, one specific combination trial found saw palmetto paired with lycopene, selenium, and a prescription medication performed better than any of those alone. So combination approaches under medical guidance are a slightly different, less settled question than saw palmetto by itself. Now let's talk about food, specifically tomatoes, because this is the one where the story is genuinely more interesting and more mixed than most videos let on. There's a well-known study out of Harvard's Health Professionals Follow-Up Study, tracking over 47,000 men across more than a decade, that found men with the highest lycopene intake, lycopene being the compound that makes tomatoes red, had a measurably lower relative risk of prostate cancer compared to men with the lowest intake. and the effect was strongest for tomato sauce specifically, which the researchers describe as the most bioavailable source, meaning your body absorbs it more easily from cooked, processed tomato products than from a raw tomato. That's one solid, well-cited cohort study. But here's where I have to be honest with you, because rule 2 of how I built this video is checking claims against independent sources, not just repeating the most quotable one. When I looked at a broader review of the epidemiological literature on tomatoes and prostate cancer, one that pooled together both case control and cohort studies, the picture was described as suggestive but genuinely controversial, specifically because not all individual studies agree, and the size of any protective effect appears to depend heavily on the type of study and the population studied. Even the researchers behind a 2020 review presented at a cancer research conference described the previous evidence on tomatoes and prostate cancer as inconsistent. So my honest read, cross-checking these sources, is there's a real, plausible, and reasonably well-supported signal that lycopene-rich foods, tomatoes, tomato sauce, watermelon, are associated with somewhat lower prostate cancer risk, especially in cooked or processed form. But it is not settled science, and no legitimate source is saying tomato sauce prevents or treats prostate cancer. It's a reasonable thing to eat more of as part of an overall healthy diet, not a substitute for anything your doctor has recommended. One more thing worth a quick mention while we're here: pelvic floor exercises, sometimes called Kegels, for men. There's a randomized controlled trial, one study, not yet a large body of confirmed research, that looked at men with BPH and an overactive bladder, comparing a standard medication alone versus that same medication combined with pelvic floor muscle training. The men who added the pelvic floor training showed significantly better improvement in urinary symptoms and quality of life scores than medication alone. I want to flag clearly that this is a single study, even though it's a reasonably sized and well-designed randomized trial, so I wouldn't call this settled the way I would the exercise and cancer risk research. But it's a low-risk, no-cost habit. And if you want to learn proper technique, that's a genuinely good, specific thing to bring up with your doctor or a pelvic floor physical therapist. I also want to be upfront about a couple of other supplements you've probably seen marketed for prostate health, because saw palmetto isn't the whole story. Beta-sitosterol, a plant compound sometimes sold on its own or blended into prostate formula products, actually comes out looking better in the research I found. A Cochrane systematic review pooling several placebo-controlled trials found that beta-sitosterol did improve urinary symptom scores and flow measures compared to placebo. Whoa, a real verified finding, not just marketing. But that same Cochrane review is careful to add 2 caveats. Beta-sitosterol did not appear to reduce prostate size itself, and the reviewers said long-term effectiveness and safety beyond the trial periods are not known. So this is a case where the evidence is genuinely more encouraging than saw palmetto, but still incomplete. Worth a conversation with your doctor, not an automatic buy. Pygium africanum, an extract from African plum bark, shows a softer version of the same pattern. NCCIH describes some short-term symptom improvement in smaller trials, but says the overall evidence base is limited, with most trials small and short in duration. None of this means these compounds are harmful. The point isn't to scare you off them if you're already taking one and it seems to help. It's that there's real but incomplete evidence is a different claim than this is proven to work. And a lot of marketing blurs that line on purpose. So where does that leave the food side of this habit? Honestly, in a pretty reasonable place. Building more lycopene-rich foods into your regular diet, tomato sauce, cooked tomatoes, watermelon, costs you nothing extra beyond what you'd spend on groceries anyway, carries essentially no downside, and has real, if not fully settled, research behind it. Compare that to spending money every month on a supplement bottle whose best case evidence is might help a little in some small studies. If you're going to put effort anywhere in this category, food is the better bet. Quick pause. Let's make this concrete. Before we wrap up, let's do a gut check together, because I don't want this to be 5 minutes of information you forget by tomorrow. Think honestly right now about your own routine. When was your last real conversation with a doctor about screening? Not just, have you had it done, but an actual discussion of whether it makes sense for you specifically at your age. When's the last time you had a genuinely elevated heart rate workout, not just a walk to the mailbox? And be honest with yourself about your evening habits. Are you drinking coffee or a nightcap 2 hours before bed and then wondering why you're up 3 times a night? None of this is about guilt. It's about noticing where the gap is between what the evidence supports and what you're actually doing, because that gap is exactly where a habit change can make a real difference. Pulling it together. So let's recap the 5, quickly, in plain language. 1. Screening after 70 isn't automatic anymore. It's a real conversation with your doctor about your individual risk, not a routine box to check every year. 2. Watch your fluids, especially caffeine and alcohol, and especially in the evening. Simple, but it can meaningfully change your nights. 3. Get real, vigorous movement into your week. The research on this, especially in men 65 and up, is some of the more consistent evidence in this whole video. 4. Pay attention to your weight and specifically your waistline. 2 independent lines of research tie this to more aggressive prostate cancer outcomes, even though not every study agrees on every detail. 5. Be skeptical of prostate supplements that promise big results. The strongest science says saw palmetto alone likely isn't doing much, and instead lean toward food-based habits like lycopene-rich tomato products, where the evidence is promising, even if it's not fully settled. I know none of this comes with a guarantee, and I'm not going to pretend it does. That wouldn't be honest. And honestly, I think you can tell the difference between a video that's leveling with you and one that's just trying to keep you watching. What I can tell you is that every single habit in this video is backed by real research, cross-checked from more than one independent source, and none of it asks you to stop trusting your doctor. If anything, it should give you better questions to bring to your next appointment. One last honest note. You'll notice I didn't give you a single supplement to run out and buy, or a single number that promises to add years to your life. That's on purpose. The strongest, most consistently supported habits in this video, moving your body vigorously, managing your weight and waistline, and having a real, individualized screening conversation with your doctor, are also the least flashy ones. They don't sell well as a headline, but they're what the evidence taken as a whole actually points to. If a video, a supplement bottle, or a headline promises you a guaranteed fix for your prostate, that's usually a sign it's leaning harder on marketing than on research. If this was useful, the best thing you can do is share it with the man in your life. This actually applies to your dad, your husband, your brother, because a lot of guys just don't get this information laid out plainly without the fear-mongering. Take care of yourself, have that conversation with your doctor if it's overdue, and I'll see you in the next one.